Safe staffing for patient care means having the appropriate amount of registered nurses, licensed practitioner nurses, and other healthcare workers in place to help the clients with returning to their health status.
Without enough nurses, there is no way you can provide safe care. You need all the people that you have in order to provide safe care.
We have significant issues around safe staffing levels, where the hospital continuously allows the staffing in our various units to fall below appropriate staffing levels.
There were times where there was a shortage of nurses on our unit, and we would need to get someone to stay back. And for that to happen, it's quite frustrating, especially on a daily basis.
So from the emergency department, then you go up to the operating room, say if you need to have surgery. If you don't have enough staff in the operating room to do the job, then your surgery is going to be late, which in the end could make you septic and you could die.
Our patients are coming in more acute, they're having multiple issues.
From the operating room, you go to recovery. If you don't have enough recovery staff, very simple things like your vital signs not being stable and not picked up because they don't have enough people to look after you, then it delays your routine again. So from a simple operation, even a complex operation, if you are not in the correct steps and you're not getting that care, it's going to delay all your treatments.
It's already been proven through the literature that safe staffing improves the quality of care and decreases mortality rates and just provides better quality of care for your patients.
We have laid off a significant number of senior nurses in order to hire a whole level of middle management. So, my concern is that when the hospital talks about safe staffing levels, we need the nurses to be a part of that conversation and part of that solution. I don't need the hospital to tell me what the safe staffing level is. I need the nurses who are working there to tell me.
To have a great healthcare system means having people on the floor to deliver it. And without the people on the floor to deliver it, we cannot provide what we should be providing as healthcare, which is more than just the basic dressing change or just getting them through the operation, or in my case, for long-term care is just getting the medications out. So we need to be able to do more than that because we are taking care of our people, our family, our moms and dads.
I would like to make sure that when LPN is sick, that they could be replaced by another LPN, not another one body, just the same. To make sure that when we need something, the help is there. When we ask for some help because of workload issues and high acuity in the unit, that they will give us help, not just say we don't have anybody.
Long-term care is important because you're looking after the elderly who are very vulnerable. Families trust you to look after their loved ones. It could be your mom, your grandma. It's very important.
I think that long-term care is important to all of us. We all are affected to some degree. Most of us have grandparents who are living in long-term care facilities and who may or may not be affected by the changes that we face. For me, I have two grandmothers who are in long-term care. I hope they're not affected by these recent cuts, but I certainly worry about them.
In my community, what we're noticing is that pretty much 50% of even our acute wards, we notice that they're aging clients.
It's not about just aging, it's about, I look after young residents as well. It's about coming to a point where you rely on others to help you in the completion of your final years. And it's about fulfilling those years living in dignity and being treated with respect.
Long-term care, I think, is certainly important anywhere across this country or around the globe. In Newfoundland in particular, Newfoundland and Labrador, our population is certainly aging. We have a much smaller population than the majority of Canada, and we have a lot of out-migration issues where younger families, individuals are moving away for employment, this type of thing. So our population is certainly aging. And Newfoundland and Labrador is very unique as well in our geography. It's a vast province land-wise. However, you know, it's scattered, the populations are scattered all over the place. So providing healthcare services and long-term care services is certainly a challenge in our province for that reason.
If it was your mother, your father, or even yourself, want or not, when we look at ourselves, we notice we're growing older. You get ailments and illnesses that you thought would never happen to you. So wouldn't it be nice to have those things in place where you know, no matter what happens to me, there's going to be something there to protect my family, to protect me. And I feel safe and I feel good about it.
I think the government needs to step up to the plate, because at some point in time, they will be in that position where they need the nurses to look after them and look after them with quality care.